the doctor would say, please, Mrs. Markey, count backwards, 100, 99, 98, and then she couldn't do it.
Trying to write a sentence, and she was making her best effort at it, and she got about halfway through, and it just became sort of dribble.
When the child becomes the parent, you know, when you have the conversations and you start demanding the car key.
Because he could pick up my mother, strap her into a chair, turn her over during the night.
It's about a disease that strikes you and a father or a husband who ends up taking all the heat.
This invisible army of millions of caregivers who are unsung heroes, many of them.
In 1900, our life expectancy was approximately 48, and now it's approximately 78.
For Alzheimer's, we do not need a mission to the moon. We need a mission to the mind.
So when you think about the money and you think about the investment, don't find a cure for me, find a cure for Nettie, my caregiver, because I think she's going to be living with this a lot longer than I will have ever myself. I have to tell all of you, there was nothing more compelling than hearing a story from someone with one of these disorders who was more worried about his wife than himself.
Do this. And one day my dad and I'd been away at college and then away in the Peace Corps in Africa and came back and going to grad school, and we got started my career and was doing pretty well in Washington. And my dad one day said to me, your mom's not what she was. That you know that what you're going through is not about you and it's not about her. It's classic. It's the disease.
I never heard of a conference which is designed in a medical setting to give guidance to caregivers. It's brilliant because they are the first responders. They're the ones who are involved with the issues on a daily basis. They're the ones who have to interact with their relatives, with their loved ones, and then be able to cope in the community as a whole.
Now, you all know the numbers. Alzheimer's disease, 5.3 million affected, $172 billion annually. Strikes me as all being very abstract, right? I can't think about $172 billion. So today, we are drilling down on a real problem that affects employers everywhere, and that's very insidious because it's invisible, and that is the employee caregiving. It costs business about $17 billion annually.
When the crisis comes, it's too late, okay? I'll just say that again because I think it's so important. When the crisis comes, it's too late. You've got to hit this before it's a crisis. You've got to know at least something about it. I tell my friends, you know, your parents are 72 or 75 and living alone, they're fine right now. Go out there and find out where the doctors are, where the assisted living places are so that you have a plan. And to employers, I'd say start reaching your employees when they hit middle age or early middle age before they turn into caregivers. Because that's how you can lay the groundwork that's going to make there's no smooth transition through a crisis, but smoother transition so that it doesn't become the total seizure event that completely overwhelms your life.
We need a breakthrough investment of $2 billion more at the National Institutes of Health, which are really the National Institutes of Hope.
Most of your employees don't care about what's behind the scenes. They care about what's in front of them. They need help in planning because they don't know how to navigate that system that you saw. And they need, most of all, probably logistical flexibility. That requires some work on your part, but that's what they really need. Do it now. Don't wait till it's perfect. This is a messy thing that we're dealing with. It won't ever be perfect. But you can actually leave here and you can go help somebody today because you will encounter somebody dealing with this today.
So his great victory was ensuring that my mother never stepped foot in a nursing home. Those are the caregivers. Those are the people who struggle at home to make sure that they do their absolute best to protect the dignity and the honor of their loved ones.